welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Cara Litvin. She is an internal medicine physician, and she wrote the Kevin MD article, Envisioning the Delivery of True Primary Care Telehealth. Cara, welcome to the show.
Thank you.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure. So I'm a general internist by training, but in addition to taking care of patients, my long-term career interest has always been to identify how to improve the delivery of primary care by health IT. So this interest actually really began almost 20 years ago now when I was a medical student and I did a summer research project which involved traveling across the country to meet with doctors who were at that point early EHR adopters. And this was well before meaningful use. And it became clear to me then that if EHRs were implemented and used properly, then they could be this incredible tool to help us improve the care we provide to patients. I think that still holds true today. So up until a few years ago, I was primarily an academic health services researcher. So I conducted studies funded by the NIH and the Agency for Healthcare Research and Quality, which focus on learning how to better measure quality using EHR data, and then studying how practices could improve their care by reorganizing their delivery system around EHR tools like clinical decision support. But then a few years ago, it seemed to me that a lot of the innovation in the health IT world was actually happening outside of academia. So I'm still an academic faculty member, but my long-term research mentor and now colleague, Dr. Steve Ornstein, and I also formed a small startup focused on developing HIT solutions to improve the delivery of evidence-based healthcare. Our first application is a platform called BP Correct. It's a remote monitoring platform that consists of a patient app and a clinician portal. And the app guides patients through a scientific approach to monitoring their blood pressure at home. It seems simple, but it's one of the most common clinical problems I encounter as a primary care physician. I have no idea what patients' blood pressure is. Office blood pressure is often inaccurate for a number of different reasons, but you have to spend a lot of time educating patients how to take blood pressure correctly at home and do it on the appropriate schedule. And an app can do all of this easily and then aggregate the results for the doctor. And so it's a clear problem that technology can easily solve. So we had actually started working to develop this platform before the pandemic started, but then as I started taking care of patients virtually, I realized how valuable telehealth platforms like my platform, but like many other telehealth platforms, could actually be so valuable in the COVID era and then beyond. And that's what led me to write this article.
Great. So let's talk about that article, Envisioning the Delivery of True Primary Care Telehealth. Now, for those who haven't read your article, can you walk my audience through it and share the story of why you decided to write it?
Yeah, sure. So when writing this article, I drew from my experience as a primary care physician taking care of patients during the telehealth era, but also from my experiences as a health services researcher and as a developer of a telehealth platform. If you think about it, before the pandemic began, at least in the primary care world, telehealth was really a niche thing. We heard about it for really acute care, so tech-savvy patients who needed urgent care but didn't want to go to the doctor's office. So for example, a patient would have UTI symptoms, they'd fill out a questionnaire or do a brief video visit and get their antibiotic and be on their way. And that's simple and straightforward, but we hadn't really started exploring how to deliver typical primary care, like management of chronic diseases, through telehealth. So when the lockdown began, all of a sudden, over really just a couple of weeks, COVID forced us to start delivering the majority of our primary care virtually. At least at my institution, we started doing video visits or phone call visits for almost all patients. And it's quite laudable that our clinic leaders were able to recreate these workflows so quickly, but we've also essentially just replicated our same model of care, meaning this 20-minute provider-patient interaction, and done it virtually. And I think that's fine for a crisis for right now, but I also think it's the opportune time to say, wait a minute, we don't have to do things the way we've always done them. This is a perfect opportunity to think outside the box. Let's reimagine how we can deliver healthcare going forward. We have all this technology now, let's use it. So I think even after a few months conducting virtual visits, we've learned what really works well and also identified the barriers. And then in this article, I describe what I envision the future of primary care could entail if we really utilize technology and implement what I consider true telehealth, which is beyond just a video connection with a patient. Drawing from my health services background, I make the point that we actually have years of extensive research that's told us what the evidence-based strategies are for delivering high quality care. We just have to figure out how to apply them to a new delivery model. So in the article, I outline some of the ideas that I have using the chronic care model as my blueprint.
Sure. So tell me, over the last few months, what
Mm-hmm.
has worked well with telehealth and what has not worked well?
Right. So I think the most important thing that's worked with telehealth is the convenience for patients. A lot of my patients love it. So I've done video visits with patients while they're on a work break or while they're taking care of a grandchild. And they don't have to drive to the doctor's office. They don't have to find parking, which is an issue at our institution. And they can be on their way. And you can also just do follow-up really quickly. So if you have an uncontrolled diabetic patient, instead of saying, oh, come back in 3 months, we say, well, we'll check in through a quick video visit in another week. So I think it increases access and improves patient satisfaction and improves patient convenience.
A lot of practices, like mine, like yours, we had to
Yeah.
implement telehealth systems within days. And there's been a lot of innovation and there's been a lot of learning points. What do you see as some of the lasting innovations from the last 6 months?
I think telehealth will persist going forward. I think we have to have private and public payers agree to continue it, but I think they eventually will, because I think we've seen that we can't go back. Like, we can't go back for a lot of different things besides healthcare. I think it's important, though, to think about other ways to innovate. And, I think that's what I talk about in my article. So if you think about the things that we don't have, the problems that we have with telehealth are our lack of access to data. So you can look at a patient and do a quick video exam, but you're missing vital signs. And that's where my platform comes in, to be able to get data vitals like blood pressure remotely. But you're also missing physical exam components. But there are things like small telehealth kits. And I envision a future where every home would have a small telehealth kit with a little otoscope and a digital stethoscope and a blood pressure monitor and a thermometer. And so, for example, if a patient had ear pain, they could put the probe in their ear, take a picture, and then that picture would be sent remotely to the doctor. I think there also would be AI to help us interpret data, like sounds from a digital stethoscope, and other vital sign data, not just blood pressure monitoring and not just glucose monitoring, but even thinking more outside the box. We have all of this data now from our watches, our physical activity, our heart rate variability, but we need clinical information systems to aggregate that information and help interpret it for physicians.
Now, who is doing most of the innovation when it comes to telehealth? Are there any big companies or are they mostly startups?
There are some big companies. I think there's big and small, and everybody is kind of exploring what the future will look like in this space. There's lots of other companies that are doing remote monitoring and chronic care management and trying to do that virtually.
So we're talking to Cara Litvin. She is an internal medicine physician, and she wrote the Kevin MD article, Envisioning the Delivery of True Primary Care Telehealth. Now, let's go forward 12 months. Let's look into your crystal ball. Where do you
Yeah.
see telehealth in September 2021?
I think we'll see continued video visits, a lot like what we're doing now. Hopefully some expansion of things like remote monitoring. I think it'll take a little bit longer to see all of the things that I outline in my article, like home telehealth kits. But hopefully over time, we'll be able to aggregate more and more information and data, and also change the way we take care of patients. So involving not just the provider, but involving the clinical staff and helping us review this data, expanding the way we take care of patients beyond just a 20-minute office visit.
And in your opinion, do you see Medicare and the other insurance payers continuing to pay for televisits?
I think so. I think it may take some time, but I think everybody's realized that there are some benefits. I think the payers will want to make sure that we do it in the right way with the right documentation, but I don't see us going back to purely in-office patient visits.
And my final question, Cara, what is your take-home message that you want to share with the Kevin MD audience?
Sure. So, even though I've been an EHR proponent all of my academic career, I don't think we've ever utilized EHRs to their full potential. And I think maybe this time we'll get it right with telehealth. The notion that primary healthcare has to happen all within a 20-minute session in a doctor's office is actually kind of ridiculous and archaic. We have this enormous technology now that enables us to truly reinvent how we provide care to patients. And I think in some ways, one of the positive unintended consequences of the pandemic is that it's been this perfect sort of catapult forward to force us to change how we deliver care. Hopefully, if we get it right, we'll eventually provide true telehealth in a way that actually improves the quality of care that we deliver to patients.
Cara, thank you so much for sharing your time and insight. And thanks again for being on the show.
Sure. Thanks for having me, Kevin.